The three of us, Pat Doherty, Cecil Rice, and myself, 14 years ago, paired with a clinic in Belfast called Threshold to provide group training. Threshold was a place that serves seriously mentally ill. They have residential and day programs, and they use mostly group therapy in their treatment of these people. So we paired with them to do a group psychotherapy conference. And so for 14 years, we brought faculty from the United States to teach, not only the Threshold staff, but other mental health practitioners from all over Northern Ireland, England, and Ireland.
Aside from working with difficult patients, many folks in the society as a whole had suffered trauma from the Civil War, and that lasts for a long time. And groups are a very good place to talk about those things.
Because of the terrible trauma of the Troubles, where neighbor were fighting neighbor and murdering neighbors, the saying was, if you say something, say nothing. And so this permeated all parts of the culture and the staff of the mental health clinics. And so people would come into the groups but not really get to talking about their deep feelings because it didn't feel safe. But over the years, we saw a change. We saw their development from very guarded, frightened, emotionally frightened people to people that felt safe in what we were providing and able to really connect with each other and let down their guard.
You can tell which side of the war they're on by their name, their last name, their first name, and also by their address. And leading a group, that was in each group, that subtlety was in there among members.
Because they were so used to not being able to identify themselves because of all that was going on in the country, they could see us as at least neutral, if not positive, and they could share more with us. I think over time, that was definitely a big thing for us and them together because they trusted us.
But the reason why outside people, for any group, not just the groups in Northern Ireland, help the group to be safe because they don't have to run into us during their day-to-day lives. What they say in the group is contained, and we aren't part of the context of their lives.
When we got there, one focused around me because I was the person who left, which made me a traitor. And so a big fight, one of our large group sessions, a big fight regarding those who left and those who stayed. And I became the focus of that. We did discover, however, some of those who fought me most tenaciously had also left and come back. So it was a kind of mixed bag of stuff. But that particular anger and fighting creates safety for the future.
There's a much greater feeling for what group therapy is all about.
Since 9/11, AGPA has really spread out around the world to provide consultation and education and support for people in times of civil strife and disasters, just like we did in Northern Ireland. We have our curriculum that we developed after 9/11, and we have a number of our members who have become expert at teaching on Skype. We've been teaching in China after the earthquake on Skype, in India after the tsunami, and some of our members have gone to the Middle East, to the Balkans, Northern Ireland, all over the world, trying to provide support and encouragement and teaching about how to use group in these terrible times.